So this is the TCOM unit, and this is the sensor. The sensor is what will be placed on the neonate. Placement, like I said, there's a few different areas that you can do. You can do side of thigh, upper clavicle, back, arm, wherever you can find real estate. Sometimes it's hard, but we do have a guide for where acceptable placements are. I'm going to show you just how it reads and how you apply it on me. It'll be different, obviously, for the neonate, but for me, I'm going to go ahead and wipe the oils off my skin, and I'm going to do it on my forearm. This is the single-use packaging that everything comes in. What's included is single-use gel, and then the ring. So the ring attachment is what secures the sensor onto the baby. Place the ring on like this, just do a couple guides around just to secure the adhesive to the skin. Take the sensor out and open the door. Applying the gel, you can either place 1 drop of gel inside the ring, like I'm going to do, or you can place it directly on the sensor tip. Doesn't matter, just as long as the gel gets on there. And then you push in at a 45-degree angle, do 360-degree swivel, close the door, and then it takes about 4 minutes for the CO2 level to sort of stabilize. And when it does stabilize, it'll turn from light gray to white. And then it'll just be a continuous monitor of the CO2 levels for as long as you have it applied to your patient. So like I said, sight times can go up for 8 hours before it would need to be recalibrated. And there'll be a little alarm that lets you know that your 8 hours is up. The center tip needs to be put back into the door, recalibrated. Recalibration can take a couple minutes, and then you're welcome to place it back on the patient. Any
Can
questions?
you place it back in the same place, or do you move it at that point?
You can. So sight times, you can do up to 24 hours. Some people like to switch it around, but you can up to 24 hours. But if you want to just move it to another placement, another side, you can do that.
Do you have to add more gel each time you
Yes.
calibrate, stick it back on?
Yeah, so this is the gel for 8 hours.
Okay.
And then, you can add, so there technically is 3 drops in here, depending on, some people, single use, you toss when you're done. If it's on the same patient, some places are okay with, putting it, near the bed and then using another drop, whatever your protocols are, but there are 3 drops in here. You can also, if you don't want to waste a whole pack, you can order these gels individually, just so you have them as backup if you need to throw this away after every use.
Because there's no way to re-close that once it's open, the gel. So
No, yeah, this
it would
is
be
open now, right?
Okay.
Yeah.
And do most people, if they move it from site to site, do they leave that
Yeah,
circular
sometimes.
on?
Yeah, so that
you're not taking it on
Yep,
and off? Okay.
yep, you can do that. You can see them like on both sides of them, just switch back and forth, depending on how long you're going to be monitoring the patient. Here it sounds like you try and get them off vents or pretty quickly. So if maybe you're going to have a patient for 3 days, and then you would do that for 3 days, and then move on. How many patients do you have on ventilators at one time?
I knew.
I will say
Like-
it's less than we used to.
Uh-huh.
I feel like it's maybe up to 3 or 4 patients a month, but it's
Okay.
probably pushing it.
Okay.
It just
They come in
depends.
waves.
It comes in waves.
It might be
Sometimes-
3 at the same time.
Yeah,
but
it
then
may
nobody
not.
for a couple weeks.
Yeah, like
Okay.
if you're talking per month, it's it varies very much, but like 3 to 4, I would say on average.
Okay.
Some months less, some months more. You know how it goes. So it's not as prevalent.
Yeah.
But it is nice. Now my question for that is, as far as infection goes, we were reading some of the pamphlets and stuff. So for some of our micro preemies or some of our very low birth weight babies, do they have issues connecting and being able to read, or like how do those do with some of our
Not
smaller
generally.
kids?
This is usually successful in probably like 90% of patients. Sometimes you'll just have a patient that has a lot of complications that we can't get a good reading transcutaneously. It's rarer, more than common. That this is like a CHOP and Hershey, you know, these level 4s that are handling like a lot of critical patients, and the 10%, it generally doesn't work very well.
What's the primary target group for the type of like patient population?
Yeah, so definitely any patient on a ventilator, so non-invasive, mechanical, those are generally the patients.
Have you seen them use this in other situations?
Yeah, I mean, so there's some, so like, CHOP has this 40% at bedsides, so the doctors just like having the continuous information of CO2. So you don't have to have that if you just want to have that information and make it used to it and they like it. That's one thing I was going to show. You know, we're going to hopefully set up an evaluation. The correlations with blood draws and this, that's what we want to show you. The doctors become really impressed, and everyone in the staff become impressed with the correlations and how accurate they are, that they can reduce these blood draws because there's just confidence in this TCOM rating. And that's the goal, I mean, because reducing pain and stimulation in these babies is obviously a big topic, and how it affects them later down the line. So if we can take a blood draw from 4 hours to 72 hours, I mean, that's amazing.
Pardon me if I'm asking too many questions.
No.
So I haven't seen any other presentations with this. In comparison to a blood gas, how close is it?
I mean, it's usually between 5 points.
Okay,
It's-
plus or minus?
It's tight, plus or
within?
minus.
Okay.
Yep. Yeah, so that's what we like to show in these evaluations, just the tight correlations.
Can you use it on a cooling patient?
Yes. Yep.
Perfect.
Yep.
Yeah.
And you can see, so my reading right now is 37.6, 37.7, so you can see, I think the trend, it hasn't turned white yet, but when it turns white, like the continuous line will start, and you'll sort of see that information. This can be tied into if you're using Epic, or it can be tied into any of your systems.
Oh, so it can be directly
Mhm.
put into the
Yeah.
EMR.
So you can have that
That's very
information
Yeah.
recorded.
Oh, there it goes.
Yeah. And then, so this is, you'll see this for that 8-hour period now, just a line moving up and down.
So you really can't see it's right there.